ChatGPT 5.2 versus Gemini 3 in clinical medicine, reasoning, risk, and workflow. Extended introduction. Why this matters to physicians. Artificial intelligence is no longer theoretical in clinical medicine. It is already embedded in documentation workflows, patient messaging, education, coding, quality metrics, and increasingly, clinical reasoning support. Whether clinicians acknowledge it openly or not, AI is already influencing care. The critical question is no longer whether physicians will interact with AI, but whether they understand how different models behave under clinical pressure. This discussion is not about replacing clinicians. It is about understanding model behavior, failure modes, cognitive bias amplification, and workflow fit. Medicine is a domain where overconfidence kills, where uncertainty must be explicit, and where reasoning matters more than answers. Any AI model used in healthcare must be evaluated through this lens. Today, we are comparing two widely used large language models, ChatGPT 5.2 and Gemini 3, specifically from the perspective of physicians. Not as marketing tools, not as consumer AI, but as clinical reasoning and workflow adjuncts. The goal is not to crown a winner, but to clarify where each model helps, where it fails, and how misuse introduces risk. Why medicine stresses AI systems differently. Healthcare is uniquely hostile to shallow reasoning. Clinical presentations are incomplete, noisy, biased, and time-constrained. Patients present late, histories are unreliable, symptoms evolve, labs lag physiology, imaging lies. In this environment, pattern matching without reasoning is dangerous. In non-clinical domains, confidence is rewarded. In medicine, confidence without calibration is malpractice. A clinically useful AI must demonstrate uncertainty, ask clarifying questions, and surface red flags even when probability is low but consequence is high. This is the fundamental stress test that exposes differences between ChatGPT 5.2 and Gemini 3. Model philosophy and design differences. ChatGPT 5.2 is optimized for contextual reasoning. It maintains conversational state, tracks prior assumptions, and often slows itself down by asking clarifying questions. It frequently uses probabilistic language, caveats, and explicit uncertainty. This makes it feel slower, but also safer in ambiguous clinical contexts. Gemini 3 is optimized for retrieval, summarization, and speed. It integrates deeply with large information corpora and produces concise, confident explanations. This is extremely effective for literature synthesis, guideline summaries, and document review. However, confidence without contextual grounding can be problematic in early diagnostic reasoning. Neither design is inherently superior. They serve different cognitive roles. The danger arises when clinicians expect one model to behave like the other. Clinical reasoning case. Dyspnea with comorbidity. Consider a 65-year-old patient with diabetes, chronic kidney disease, hypertension, and progressive dyspnea on exertion. Chest X-ray is unremarkable. Vitals are stable. Labs are equivocal. ChatGPT 5.2 tends to organize a structured differential. It explicitly discusses cardiac ischemia, HFpEF, anemia, pulmonary hypertension, deconditioning, medication effects, and occult infection. It frequently suggests next diagnostic steps while clearly stating uncertainty. Gemini 3 often produces a clean, guideline-aligned summary of possible causes, but may omit the reasoning chain that connects comorbidities to pathophysiology. This is efficient, but less cognitively supportive. For clinicians, reasoning transparency is not optional. It is how we audit thinking and avoid premature closure. Cognitive bias and AI interaction. AI does not eliminate cognitive bias, it amplifies it. Anchoring bias, availability bias, and confirmation bias can all be reinforced if clinicians use AI incorrectly. A model that confidently confirms an early hypothesis is more dangerous than one that challenges it. ChatGPT 5.2 is more likely to challenge assumptions by asking clarifying questions. Gemini 3 is more likely to reinforce the framing provided. This difference matters most early in diagnostic reasoning, not late. Clinicians must remain aware that AI outputs are not neutral. They are shaped by prompts, framing, and prior context. Documentation and clinical workflow. In documentation, ChatGPT 5.2 integrates naturally into SOAP note generation, discharge summaries, and patient-facing explanations. It adapts tone and structure fluidly and can reduce documentation burden when used appropriately. Gemini 3 excels at summarizing long documents, extracting guideline recommendations, and reviewing literature rapidly. It is particularly useful for policy review, research synthesis, and administrative tasks. Attempting to use Gemini as a reasoning engine or ChatGPT as a bulk retrieval engine leads to frustration and risk. Patient communication and education. When translating complex medical information into patient-appropriate language, ChatGPT 5.2 performs consistently well. It adjusts literacy level, acknowledges emotion, and reinforces follow-up. Gemini 3 provides accurate explanations but may lack emotional calibration. In patient communication, tone matters as much as content. Safety, liability, and regulatory reality. Neither model is HIPAA compliant by default. Neither assumes liability. Clinicians remain fully accountable. AI outputs must be treated as educational suggestions, not clinical decisions. ChatGPT 5.2 more consistently includes disclaimers and emergency flags. Gemini 3's confident tone can be misleading if interpreted as authoritative guidance. Clinicians must treat AI like a junior trainee who never sleeps, never examines patients, and never carries responsibility. Hallucinations and failure modes. Both models hallucinate. They fabricate citations, they overgeneralize, they extrapolate beyond evidence. The risk is not hallucination itself, but unrecognized hallucination. Practical recommendations for clinicians: use ChatGPT 5.2 for clinical reasoning support, differential development, patient education drafts, documentation assistance. Use Gemini 3 for literature review, guideline summaries, large document synthesis, administrative analysis. Never use either for final diagnosis, independent medical decision-making, emergency triage without human oversight. The future of clinical AI. The future is not autonomous AI. It is augmented cognition. AI will increasingly act as a cognitive offload, not a decision maker. The clinician remains central. Models that surface uncertainty, challenge assumptions, and slow thinking will ultimately be safer than those that optimize for speed and confidence. Final verdict. At present, ChatGPT 5.2 demonstrates stronger alignment with clinical reasoning patterns. Gemini 3 remains a powerful retrieval and summarization engine. The safest approach is intentional, role-specific use of both. Closing. I'm Dr. Saab. This is My AI Doctor. The goal is not faster medicine, but safer medicine. Subscribe for clinician-led, evidence-based discussions on artificial intelligence in healthcare. Use my voice for the narrator.